For the 5th year, GI cancer experts are gathered for the Gastrointestinal Cancers Symposium. I'm talking now with Dr. Jordan Berlin from Vanderbilt University, who chairs the program committee for this year's symposium. Dr. Berlin, could you fill us in a bit on the history of the symposium?
This meeting evolved from the thoughts of Margaret Tempero, who was chairman or president of ASCO at the time, and she thought that it would be a good idea to have a multidisciplinary meeting that separated out a disease site so that people who are overwhelmed by the large ASCO meeting can come and focus on both the education and the science of a disease site, such as GI cancers. This meeting started 5 years ago, and it has evolved from a small meeting with education and science presenting the abstracts to adding in meet the professor sessions, a keynote lecture, and a variety of other things, but it remains a multidisciplinary conference that is established from 4 different specialty organizations, from gastroenterologists, surgeons, radiation oncologists, as well as the medical oncologists. 591 papers were submitted this year, which is 110 papers more than last year. So it was about a 25% increase, which is a wonderful number for us. And we have more papers than ever. Half of those papers came from outside the United States, showing the international flavor of this meeting. And a large number of the attendees come from outside the United States, from all continents, except maybe Antarctica.
So then the question then becomes in hot topics, and I've been here, I've heard a lot of interesting reports in terms of gastrointestinal cancers, but it seems to me that not a lot of hot topics. Where are we? Right? What is the state of the art right now in gastrointestinal cancers?
Gastrointestinal cancers have gone through an interesting evolution in the last 5 years since this meeting started. We had a few very hot years, particularly in colorectal cancer, and then last year in hepatocellular cancer, where there were new and exciting findings, with last year's hepatocellular cancer finding of being a new drug for the very first time in that disease. Now, this year at this meeting, I would say that we do not have any of the hot topics where something dramatically new has come up, but cancer is an evolutionary process. We develop things slowly sometimes we develop things quickly. Right now, I think we're in a period where we're adjusting what we know. We're dealing with some of the side effects. We're learning more about the biology of the disease. Some of the highlights from this meeting include presentations on the stem cells in gastric cancer, and last year we had stem cells in pancreas cancer. These are not stem cells that are publicized by the politicians, but these are the cells that may be the origin for the cancer cells, and they may be continuing to feed the cancers to allow them to keep regrowing back. And they may be more resistant than the normal cells that you see in the big block of tumor that you take out. And those cancer stem cells may be the things we really need to target in order to cure this disease. So learning more about those may be important.
So what I'm picking up in my days here is this sense of refining treatment, which obviously is valuable to the clinician, and better dosing, better tracking, better monitoring, different combinations, and in essence, those very small steps that are made to improve overall results. Is that a fair estimate?
Yes, that's a very fair estimate. For example, 10 years ago we had 1 drug for colorectal cancer, and now we have 5 classes of drugs, multiple drugs within those classes. And some of the presentations tomorrow will include how did we tweak those? Can we move them around to change the sequence, or combine them in a different way to make them better? Or one of the important papers tomorrow is actually on the side effects. We know that some of the drugs cause side effects. We've never kidded ourselves about that, and I think it's very important that we know how to deal with them. We had a method that we thought would be great for dealing with a side effect from one drug, oxaliplatin, to decrease a sensitivity to cold objects. That method turned out to actually reduce the response rate to the regimen, even though the initial reports did not show that, and we'll be seeing that data tomorrow.
So again, that's just that refining, that tweaking, everyday practice for a medical oncologist, it seems to me.
This is changing our practice in subtle ways, but important ways, to make patients feel better, maybe to make them live a little bit longer. We don't have the spectacular breakthrough findings this year, but we don't know what next year will hold.
And just a few words about the multidisciplinary aspects of this meeting. There are 4 different sponsors representing some different disciplines, and I'm wondering if you could just address that.
So this meeting is developed and worked on by members of all 4 sponsoring organizations: the American Gastroenterologic Association, American Society of Clinical Oncology, American Society of Therapeutic Radiation Oncology, and the Society of Surgical Oncology. A lot of words, even more letters. And what happens is there is a steering committee that oversees it all with a member from each organization. The program committee is made up of equal members, both international and American, from each of the 4 sponsoring organizations. And we make the decisions how to put this meeting together as a group. Each of the chairs for the tracks, and we're divided into 3 tracks based on which part of the digestive tract we're in. Each of the tracks is run by a different sponsoring organization, so that we balance this out, and that has been a wonderful interaction. Bringing the 4 groups together allows us to interact, not only planning the meeting, but at the meeting, so that people can see the real-life treatment of GI cancers, because it is a multidisciplinary treatment. Every time I discuss a patient at our tumor board, there are 4 or 5 specialties sitting in the room helping to make the decision on the treatment. So not to have them in the room at the meeting seems silly.
Thank you, Dr. Berlin. From Orlando at the Gastrointestinal Cancer Symposium, I'm Peggy Peck, MedPage Today.